Hypothyroidism is the term used to describe inadequate output of thyroid hormones by the thyroid gland. There's a few different causes. The most common cause of hypothyroidism in the developed world is Hashimoto's thyroiditis, and this is caused by autoimmune inflammation of the thyroid gland, so the body's immune system attacking the thyroid gland. It's associated with anti-thyroid peroxidase or anti-TPO antibodies, and also with anti-thyroglobulin antibodies. Initially it causes a bit of a goiter, after which there's atrophy of the thyroid gland as the hypothyroidism sets in. Iodine deficiency is the most common cause of hypothyroidism in the developing world, and this is because iodine is essential for the production of thyroid hormones. Iodine is added to foods like table salt to prevent iodine deficiency and to prevent hypothyroidism. Hypothyroidism can also occur as a result of treatment for hyperthyroidism. So all the treatments for hypothyroidism have the potential to overshoot and cause hypothyroidism. So these are treatments like carbimazole, propylthiouracil, radioactive iodine, and of course thyroid surgery. There are also medications that can cause hypothyroidism. Lithium inhibits the production of thyroid hormones in the thyroid gland, and so can cause a goiter and hypothyroidism. Amiodarone interferes with the thyroid hormone production and metabolism, and usually it causes a hypothyroidism, but it can also cause a thyrotoxicosis. There's also secondary causes of hypothyroidism, or central causes, and this is where the pituitary gland is failing to produce enough TSH. And this is often associated with a lack of other pituitary hormones as well, such as ACTH. And this is called hypopituitarism, and it has quite a few different causes. And these causes can be tumours of the pituitary gland, infections in that area, vascular pathology, such as something called Sheehan syndrome, where you get pituitary necrosis after massive blood loss during childbirth, and radiation therapy to the pituitary gland. So how do patients with hypothyroidism present? Well, they can present with weight gain, fatigue, dry skin, coarse hair and hair loss. They can have fluid retention, so they can develop edema or pleural effusions or ascites. They can have amenorrhea, so the periods stop, and it can slow down the bowels and make them very constipated. So when you suspect hypothyroidism, how do you investigate them? Well, firstly, you would do a TSH, find that the TSH is abnormal, and then do T3 and T4 levels. In primary hypothyroidism, this is caused by a thyroid gland insufficiency. So the thyroid hormones like T3 and T4 will be low, and the TSH level will be high, because there's no negative feedback to the pituitary gland, so the pituitary produces lots of TSH to try and get the thyroid working again. In secondary hypothyroidism, it's caused by pituitary pathology, and that results in a low production of TSH. So TSH will be low and the thyroid hormones will be low. How do we manage hypothyroidism? Well, it's quite straightforward. We simply replace the thyroid hormone that isn't there with oral levothyroxine. So we give them oral thyroid hormone in the form of levothyroxine. Levothyroxine is synthetic T4, and it metabolizes in the body to T3, so you get T4 and T3 from this one medication. The doses are titrated until TSH levels are normal, so when you start levothyroxine, initially measure the TSH levels monthly until the TSH level is stable, and then once stable it can be checked less frequently unless the patient becomes symptomatic. So if the TSH level is high, you know the dose of levothyroxine is too low, so it needs to be increased. And if the TSH level is low, you know that the dose of levothyroxine is too high and it needs to be reduced. So thanks for watching.